Okay, thanks for having me. I'm going to talk about actually implementing Teen Intervene in school-based health centers. And like they said, my name is Jessica Dyer. I'm the Behavioral Health Project Director for the California School-Based Health Alliance. And before this role, I worked in direct care in school-based health centers in Oakland, California, and in community clinics. And we, at the school-based health centers that I was working at, we were part of the piloting of SBIRT and Teen Intervene years ago. So I've been doing this for a while. And I think Teen Intervene is a really great intervention. I'll talk more about that. So again, California School-Based Health Alliance, we are located in California. If you want to know more about us, we've got lots of resources on our website. So I think that Teen Intervene being implemented in school-based health centers is a really great model due to the integrated nature of school-based health centers with primary care, mental health, substance use, health education, all taking place in one location. At the school-based health centers that I was working at, we implemented the CRAFT screen into all new visits, and then if students were coming in not for their first time, but making sure that annually they were getting a CRAFT screen at medical and behavioral health visits. And then the medical providers would provide a brief motivational interviewing intervention if there was a positive screen, and then referral to Teen Intervene. And a lot of times, having both of us be at me as a behavioral health provider and medical provider at the same location, we were able to have warm handoffs, which, as many of you know, really increases the return of the students and making sure that they actually do come in for their appointments. And so we were able to make that happen. Some of the challenges in implementing Teen Intervene that came up when we first started was having medical provider buy-in. There's so much for medical providers to cover in not that much amount of time. And so having another intervention and another screening that they had to tack on to their large list of things they have to do was a challenge at first. But I think one of the things that really helped us overcome that was have our integrated meeting. So we met every week with behavioral health, health education, and medical providers. And just being able for me and whoever's doing Teen Intervene to be able to talk about the impacts that we were seeing on students and the changes that we were seeing in students by using the intervention really got providers to be able to come on board. And it took time and consistency of having those meetings and talking together regularly. But over time, we were able to get pretty much all of our medical providers and health educators, everybody on board that this was something that was important and worth the extra time to do. Which then ran into another challenge that we came up with, was actually having so many referrals and a lot of students and only me to provide the intervention at the sites I was at. So we ended up doing the group model, as Ken talked about, and I found it to be really effective. Students like to listen to each other more than they like to listen to adults a lot of the times. And so, like Ken said, it's not in the manual about how to do it as a group, but I think it really translates really well. And we just, as for the group model, I would just have them do the exercises and more of like a general, if this were to apply to anybody in the world, for the pros and cons of use, or the triggers and cravings, like just generally what comes up for people in the world, and we would like brainstorm those on big sheets. And then for their own individual reflection, I would have them do that on their own in writing, and then sharing out in a circle format as they felt comfortable. So nobody was put on the spot to share things that they didn't want to share. But there was room for self-reflection, larger reflection, and then peer support. And especially in the goals and overcoming obstacles and goals, students found each other to actually be peer networks of support. And there was one session, I just really remember this one, where they were talking about social situations and what they could do. And students talked about, well, we could text each other, and they exchanged phone numbers, and they created a network of support for each other in having alternatives to using. So I just love the group model. Another challenge I think in doing Teen Intervene that I did a training for some providers a couple of weeks ago. I'm doing this across the state of California, and a challenge that came up was when Teen Intervene is connected to punitive discipline. When it's actually given as a punishment for students, youth are not very likely to engage in it. They see it as a punishment. And so really trying to think through in your schools, if this is being implemented, using it as an alternative to punitive discipline and not used as punitive discipline for students. I think it's really important. And one of the things that I really appreciate about the Teen Intervene model is that it really meets students where they're at. It respects them where they're at in the change model, and that sometimes at the moment that they come to the session with you, they might not be ready to change. They might not actually be open to that at that moment, and that's okay. That in Teen Intervene, we're really meeting the student where they're at, we're respecting them, and just leaving the door open for if this is something they ever want to explore, that they're welcome. And we're just helping encourage their own self-reflection in their life and helping them to really evaluate the role that substances are playing and whether it's helping them or not, and what they think about that and what they want to make happen. And being able to come at it from just this really respectful, open place without any judgment and just rolling with where the kids are at. It actually happened a number of times where when I initially did the sessions with them, students weren't ready to change. And I was like, that's okay. Like this is your life. This is what's going on for you. And then months later, they would come back and say, well, things are different now and I need some help changing. As kids would get jobs and they'd be like, I need to stop smoking because it's going to not let me be able to do this job, or I'm actually failing my classes and I don't want to do that anymore. Can you help me now? Now I'm noticing that this is impacting me. And so I just really appreciate that this model is about just meeting kids where they're at, and that when they're ready, they know that they can come back to you. And then you can help them then. And so one of the things I just want to also touch on is that sometimes, as Ken mentioned, kids are actually in more severe substance use, and Teen Intervene is not necessarily the only model that they will need. We could use Teen Intervene when kids are waiting to get into more intensive support, but if they do need some more intensive substance use support, one of the things that we did was actually go out and partner with the adolescent serving substance use center in the area, and we had them come to our clinic, and we went and toured their clinic, and we created an MOU that when we would make a referral to them, they would do their best to get the kid at the top of the list and get them in as quickly as possible. And just making that personal connection was really helpful. And actually going and having them come tour our school-based health clinic and us going and tour their clinic just helped to build that rapport with providers. And then also to be able to follow up. So if we did make a referral, they knew who we were, and being able to connect around whether students were getting the services, whether they were showing up or not for what they needed. So I really recommend making the connections with the partners in your area. And then, like I mentioned, so a couple of weeks ago, we in California, we did a Teen Intervene training for a number of providers. And some of the things that we found in that training is that additional motivational interviewing training can be really helpful. Teen Intervene is a wonderful model, and it seems really simple and straightforward, but it actually takes a lot of skill to do it really well. And so more support in the motivational interviewing skills helps people to really be able to do this in a skillful way. And another challenge that I noticed for clinicians is that it can be, and just health educators, people who are training, is that it can be hard when it comes to substance use to get out of this role of the educator. People really wanted to know, well, what are the exact harm or impacts of these different drugs so that we can educate the students on what the impacts are. And while that's important and helpful information to know, that's not necessarily the goal of Teen Intervene. Our goal in Teen Intervene is really to elicit from the students what their experience and their perspective is. So help them to have that self-reflection on what role and how drugs and alcohol are impacting their own lives, and not necessarily to come at them from this expert role of this is what's going to happen, this is how drugs will impact you. But really, our goal is to elicit from the student what's going on for them, and then to help build help elicit from them their intrinsic motivation, not us as the experts. And so that is just a shift in perspective that can be challenging for people. And so, yeah, just that Teen Intervene really sees students as the experts in their own lives, and we're there as collaborators with them and what they're wanting for their lives, helping them to notice what it is that they want to achieve in their life and how are substances helping or getting in the way of that, and how can we help them achieve the goals that they want, and setting small goals so that they can be successful. So those are just the things that we learned from that, and that people are really interested in the group model also, that I think people are wanting to do that. So I'm excited, Ken, for if the new manual comes out with some suggestions on that, because I think people are really interested in that. And that is all from me.